Namaste, I'm your Dr. Kiran. My topic today is abuse of medical students and postgraduates. Where does this abuse come? No facilities. Either in the hostels, always facilities are deficient. I'm talking about my medical student times when students didn't have proper bathrooms. Medical students, they didn't have a proper mess. They were managed by student unions and all the politics of student union. So there's no proper supervision. The normal young girls and boys coming from far off villages or even in corporate management based colleges, no student is today happy with the mess they are given. Abuse starts there. Food, basic requirement is food. You expect a doctor to perform very well, behave very well later. When you abuse this medical student of 19-20 years for almost 15 years till they finish their PGs and super specialties, and then you expect them to be saints? How? It starts there. Once you go into the colleges, what happens? As I understand, I don't know about the developed countries. Let me talk about my own country so that some people may just see this and maybe some changes may come. They don't have the background. They don't have the background, and the medium of teaching is English. I appreciate some states which are trying to bring in the medical education in the local languages. But it's in a way, maybe it's a wrong move. Then you are restricting that medical student only into that state. Once he or she wants to go out of the state in India, or wants to go abroad, they're caught. Learn your mother tongue. Never neglect your mother tongue. But English has to be accepted because it is almost universal. Almost. I don't say it's everywhere. No, every country doesn't speak English. But English is a little more accepted language than other languages when you go abroad or when you cross the state. Our academic jargon, meaning our language which we use in for example, in orthopedics, is of such a high standard. And as a student, as a doctor, I find why others use tricky language. They will say, for example, when we go over for our exams or our post-graduation exams, how the young student is abused. You want to test his or her talent, her intelligence and remembrance. Good. Don't test their patience and confuse them. There's no point. That is academic sadism by senior doctors like me and you. What is happening? For example, they'll say the length of certain structure is about 2 centimeters, is less than 2 centimeters, is almost 2 centimeters, is not 2 centimeters. Why? Just can't you ask a question, straight question? What is the length of that particular structure? You can't expect a young brain of 19, 20, 21 years to just say it is about, and that is the answer, about to 2 centimeters. Why do you confuse them with such grammatical English and say, no, you didn't get a rank? Unfair. When you were at that age, what were you? Could you really know that that particular structure was not about or almost? See, we are confusing grammatically. Don't do that. Please don't do that. Now I move on to one more thing. Abuse by the lab technicians, by the senior professors based on caste, religion, bribery to pass medical exams is existent. See, all the authorities, if we all are mute to these kind of problems, we say it's all a crime, you report here, you report there, and the information automatically leaks to the professor, and that candidate will never pass in his life. So who dares? So why should we invite some parent or somebody to complain on the professor of medicine or professor of surgery or professor of any other biochemistry, anatomy? No, it should not happen. It's basic ethics and dignity of a doctor to withhold as a professor or assistant professor or whatever cater. This corruption must not be there. You're abusing the candidate. You're changing the perception. A young candidate, young student has just come into medicine and you're teaching them that you give money, you pass. Wrong. Give your merit, you pass on merit, you get the rank. How beautiful that is. I had a professor who was always a lady professor who always wanted some kind of a sari, some kind of a gold something, and then there'll be a hike in the marks. One professor was there who wanted his bottle of scotch or something else. So shameful. And before the PG exams, the externals who come, they are taken for a party to give a good result for the college. So what kind of mentality are you giving to the medical student or a postgraduate? I leave it to you. These have to be a self-reflection by seniors like us. I'm a private practitioner. I have never done all these things, even though for 13 and a half years I was in the government service. Never. When I can, why can't you? And did I not grow? I grew. I grew in my finances. I grew everywhere. Yes, maybe I didn't grow very excessively, which is not needed. As a postgraduate, I have seen there are no pillow covers, there are no bed sheets. Hawaii chappals they used to give us to go into our traumatology OTs. Horrible state. The black, the white Hawaii chappals. I'm not demeaning anybody. I'm just saying these things must not happen. The bed sheets have not been taken away. And the lady house surgeons and the lady PGs, they were sleeping just like this on the table of the casualty medical officer. One day when I went as a PG, I told that girl, please go and sleep in my room. I'll sleep here. And I did what she was doing. I slept on the table of that casualty medical officer, and she relaxed for a few hours and said, sir, please go and sleep, sir, and thank you very much. This is the kind of security and assurance we give to a medical student, saying that we are proud of you. And then now I see 38 hours, 40 hours continuous duty. What kind of sadism is this? 38 to 40 hours of continuous duty. Recently, one student came back to her house, and her mother came running to me and said, sir, what sir? Amen, Amma, what happened? She lost 10 kgs, sir. I can't see her eyes. They're so sunken into the sockets. She's looking devastated. What is the point, sir, we are spending? And the cost? 2 crores, 4 crores. I'm not saying everybody has the capacity to spend, and why should they spend? Let's not go into the ethics of management seats and donation seats. It's happening everywhere. The way you treat your medical student as a professor, as a superintendent of the hospital or resident medical officer, whoever is concerned with the management, can't you give a proper pillow, a bed sheet, a normal AC and dignified room for your interns or anybody who are doing their 38 hours of duty? This is academic slavery and authoritative abuse of our own students who are tomorrow going to join our hospitals as assistant professors, tutors, and they go gradually into associate professors and professors, HODs, superintendents. So the mindset, you have spoiled their mindset when they were students. No medical student, either a foreign educated who writes his entrance exam in India, comes and settles here, nor anybody. You're not sparing anybody. The same kind of academic abuse, and also, no, maybe it's authoritative abuse. You don't let them voice their opinion. There is no crisscross mutual discussion. What are your problems, doctors? Please tell me. If I'm the superintendent or the maybe health minister or anybody, I will ask, what are your problems? Let the students speak. What happened in Kolkata, RJ Hospital, that is a reflection of what need not happen. She just went to rest, poor lady. It's happening everywhere. That's just as tip of the iceberg. So it's time, seniors, senior doctors in the government service, in the Indian Medical Association, wherever we are, we seniors must take out our voice. Because we forgot to use our vocal cords. We use it only for trolling. Our medical students, if you want them to be good doctors, academicians, you give them some peace of mind, they refresh in their mind, and then they come and perform on their theses or symposia or any seminars very well. If you don't give them time to sleep, Students are not getting time to eat. My God, they are not getting time to eat their food. Yes, they're calling Zomato, this, that, Swiggy, and all these people. We should not smoke, we should not drink. But this is what these youngsters will go into, because they don't know how to relax. Finally, why is a doctor dying so early? Many young students are dying. Suicide, heart attacks, health failures, diabetes. Why? Infertility. You're spoiling the circadian rhythm. They don't have time to sleep, my dears, professors, superintendents, HODs, anybody, no problem. Hear me out. I appeal to you with folded hands. Please treat our students with love and concern like a parent, please. This abuse of doctors is continuing even after the graduation or post-graduation or super specialization. Most of the doctors, once they set their practice, it is the unqualified quacks, unfortunately, who are bringing patients, who are controlling the in-pour of the footprint of the patients into the clinics, hospitals, and unfortunately 30% they demand and take the money away. If anybody refuses to accept what I'm saying, prove me wrong. Plus come, prove me wrong. 30%. What they did? Why should they even practice? So why are we keeping quiet? Why are we failing? Because we were never taught to fight back. We were never taught to raise our voice. At least to our rights. We have doctors' rights. Are we not human beings? Once we go into a hospital, again a new problem. Doctor, your salary is so much. You're supposed to do 20 knee surgeries per month. Come on. The patient must need a knee replacement or a hip replacement or a spine surgery. No. These many say, doctor, you're falling back on your investigations. Dr. C has done so many cases. He has generated so much of revenue. Why, doctor? You're not able to. This is the way we are talked to. This is the way we are talked to in our meetings in the hospitals. Whether it's in India or abroad. I faced it. Prove me wrong? Come on, prove me wrong. Touch your hearts. Your soul is hearing. Each doctor, don't lie. Touch your heart. Just listen to your soul. What I am telling is truth. This is how we are dealt. And you expect the doctors to be kind and say, hello, how are you? Entama, how are you, ma? Da, please sit down. No, we are just slaves on the computers. 45 patients, 50 patients. Type. Or they give a transcriptionist who also type. You're not given. You just want to go for your washroom. You can't. There are 40-50 patients. You take 5 seconds, 5 minutes extra, you get a call from the reception. Doctor, a patient is waiting. So you have to take the history. What are the old reports? You have to review. No, doctor, the patients are waiting. Yeah, patients are waiting. So don't load so many. Hire one more. But we don't have the voice. We don't fight for our rights. We are useless. And we suffer. That's why depressions, burnouts, suicides, diabetes, early heart attacks, strokes, or just detachment. Answer yourself. Why are we allowing, especially non-medical people, to sit on our heads and tell us what to do? Tell us how to treat a patient. They are just revenue. So it's just slavery. How many diamonds you bought from the diamond mine? We are just like miners. Think it over. The governments, all governments, abroad, everywhere, here, you will have some similarities. Not many maybe. Don't think India is only suffering. No. Everywhere. And at the end of the day, doctors are blamed for seeing patients for a very long time. Doctor, you're getting very slow, doctor, with your patients. And we are removed. We are terminated. Our salaries are not given. We go to courts. We don't get the money. Trickster's world. This is a trickster's world, not for genuine people and not for genuine doctors. So, who wants to set things right into the reset button? Please help us.